Well, hello, Gold viewers from around the world. I'm Kristen Schwartz, licensed midwife and one of the MCs here at Gold. And today I'm chatting with Dr. Nhu Tran about her upcoming presentation titled The Heart of the Problem, Cardiac Monitoring in the NICU, When to Worry and What to Do. Welcome, Nhu.
Thank you. Happy to be here.
It's wonderful to have you here. You are, of course, presenting for our Gold Neonatal Online Conference of 2024. That's just around the corner here in the beginning of June. We're excited to have you here. So before we jump into your topic, tell us a little bit about your background. You are a nurse scientist. So talk a little bit about your professional journey and your research interests.
Yeah, well, began as a nurse in 2001, and I went directly into the neonatal intensive care unit because we had a nursing shortage in California. So I was working in the NICU for many years, about 12 years, and that's when I did my first research project that got me interested in doing research. From there, I became a research nurse coordinator and then decided to get my PhD. I wanted to learn more of the rigorous approaches with research and study design. So since then, I've been doing a combination of both direct patient care as a nurse in the NICU, as well as my own program of research. And so with my program of research, I'm trying to find out why children that are born with heart defects are at higher risk for developmental delay. So currently, we're looking at whether cerebral dysregulation or decreases in brain oxygenation are associated with developmental delays in children that are born with heart defects. So we're looking at that and then looking at healthy babies to see what's going on with the CHD group that may be different, hoping to develop interventions to improve their outcomes.
Absolutely. That's fascinating and such a great course of study there, because I feel like something I talked to one of your colleagues from the program about here a couple of days ago, thinking the area of study or research for NICU is a relatively young study field if we compare it to adult, medicine or even pediatrics, right? So there must be so many areas that are still under-researched. And especially now with the little ones being younger and younger when they're coming ill, or being able to survive at a younger and younger age, there must be even more need for research as well, right?
Oh, definitely. Yeah. And both neonates with congenital heart disease and neonates in the NICU, like preterm infants, surgical infants, they're all at higher risk for poor developmental outcomes compared to healthy children. So there's a lot of overlap in the potential risk and interventions that can be performed in those groups. But definitely it's a newer field and an expanding field, and we need more people doing research in these populations to improve their developmental outcomes, especially for the patients, the children, as well as the parents.
Yeah,
because it's such a stressful time.
Oh, absolutely. I can only imagine how stressful that is for the parents, maybe ending up with a baby in the NICU that wasn't, was a surprise that it, the baby needed to go into the NICU. Others were prepared for it, but you're never quite prepared for it, no matter what. It's your baby, right? Then in the NICU, and it is incredibly stressful for these parents, which should be such a joyful time being with their newborn, but going through all that. Yeah, and so talking about cardiac issues, what are the most common ones you see in the NICU?
Well, it's going to be some of the items that I'll be talking about, but definitely different types of arrhythmias like sinus bradycardia, sinus tachycardia. That's when the heart rate's too slow or the heart rate's too fast, but also varying types of heart defects. They can be as simple as a ventricular septal defect. In the talk, I'll be talking about the more complex heart defects, like hypoplastic left heart syndrome. And so some of those defects may be specific to my experience working at a tertiary center. We see the sickest of sick, where neonates are transferred for surgical or higher level of medical management. So it's different types of care before, during, not during the surgery, but potentially during the surgery, and then after the surgery, and then different arrhythmias and how to detect them, what potential treatment options there might be and what to look out for.
Oh, fascinating. There's so much to learn. In your research now, is there anything that kind of surprised you? You know, some research outcomes maybe you've kind of expected. Was there something that you say, wow, I did not see this coming or did not anticipate this?
Yeah, we've not yet published it, but with some of our preliminary analysis, it seems like the regulation of cerebral oxygenation in the CHD group, the congenital heart disease group, they have decreased cerebral oxygenation, regulation of their cerebral oxygenation. And then at the neonatal, at the newborn age. And then as they get older, meaning around 9 months, that seems to change compared to the healthy controls, meaning they flip the CHD group, their brain oxygenation increases and the healthy controls decrease. So there's the opposite effect. Whereas at the earlier ages, meaning the neonatal ages, 3 months, 6-month ages, we see the CHD group have a decrease in brain oxygenation. So we're trying to see what's going on there and seeing why is it changing as they get older in age. It may be something physiologic due to the repair of the heart defect or the palliation of the heart defect, but we don't know. And it's something where I still need to look into the data to make sure that there's no errors in data entry or anything like that. But that's something different than we anticipated. We anticipated them always to have decreased brain oxygenation throughout their younger, early childhood development, which potentially may be a cause for the risk for developmental delays. But we'll see.
Well, yeah, thank you for sharing that. It's fascinating and very interesting. And, you know, and I'm looking forward to one day learning where your journey goes with that, because once you know more, maybe you'll be back and tell us on that. Now, also about your presentation. Now, tell us a little bit about it and what you're hoping our viewers will take away from this presentation here.
Yeah, well, I want to talk about a little bit of the basics of cardiac electrophysiology, just so that we're all on the same page. And it may be a little bit basic for some of your participants, but it's helpful to know because it will give you a background into the different arrhythmias that we'll be going through. We'll hope to keep you all engaged with some questions throughout the presentation, as well as talking about the different varying complex cardiac defects and their surgical management and treatment, as well as different arrhythmias and their treatment, medical treatment as well. So I hope that the participants can learn and get stimulated and get more interested in CHD. I know when I was a new NICU nurse, the CHD babies, I was always scared of them. But now that I've had more experience, I've become more comfortable in caring for these types of
It is kind of scary, as I can only imagine. It can be very unpredictable too, you know, a very unpredictable environment with them. And yeah, I can really, really imagine how that, as the caregiver, the nurse, for the staff, can be very, very stressful. Yeah, to care for these little ones.
You know, CHD is congenital heart disease is one of the leading birth defects. It affects about 1% of all live births. But it's a small part of the NICU population. So it's not as common as seeing extremely preterm infants or surgical infants, et cetera. So it's still something where we don't commonly take care of them.
Yeah, absolutely.
But not as common as the other.
But not as common as, and I feel like a lot of education is needed. I'm not myself directly in the NICU, but even in the field of midwifery, we, you know, even with all the technology we have and all the ultrasounds, sometimes we still have one where we go like, is this what's going on with this baby? You know, and a congenital heart disease is detected even later, because and it's very surprising in ways how it shows up, not the typical how you're taught textbooks wise, you know, but a little bit different. And it can be very unsettling that you constantly question yourself, what am I not seeing? What is going on here, right? So yeah, thank you for sharing that with us here. And we're looking very much forward to your presentation. Any last words for our viewers here, for our viewers here at Gold from your side, what you would like to share?
No, just I hope you enjoy it and ask as many questions as possible. It's always helpful for me to be able to clarify anything that might be unclear. But I'm happy that people are interested in the topic, and happy to share my knowledge as best as possible.
Well, thank you so much, Dr. Nhu Tran, for being here with me today and chatting about the presentation and all your wonderful work you're doing on the bedside there in the hospital, as well as in research. Thank you so much for being here with us today.
Thank you for having me.
And for our viewers, now some information. If you would like to find out more about this particular presentation and all the other presentations in the Gold Neonatal Online Conference, we invite you to go to goldneonatal.com. On June 3rd, we get started with the conference, and we get started with an open access, free of charge, keynote presentation by the wonderful Dr. Niels Bergman on skin to skin, of course, in the NICU there. And we hope to see everyone at that particular presentation, and also the rest of the presentations as well. And if you cannot be there live, all the presentations are always recorded. So make sure you check them out at goldneonatal.com. Thank you everyone for watching. Have a lovely rest of your day. Bye-bye, everyone.